these computers.
Okay, the meeting is now live streaming. You can start whenever you and Ashley are ready, Yvonne.
Andrea, I copied you on it too, just to make sure it went through. Did you get it? So make sure you got it.
I'm sorry, Trevor. I'm waiting for it to finish scanning.
Oh, okay. All right. As long as it went through, I just wanted to make sure.
It
Okay.
went through, it just didn't show up. So we
Right.
will start. That's okay. We have a presentation. Not too dramatic. Everything's ready, live stream, Madam Clerk?
Yes, everything is live streaming.
All right. I'd like to call the Health and Human Services and Aging Committee to order, May 7th. I don't know the date. I don't think it's the 17th, 18th,
May
19th, 19th. I was going down my days. 1:02 p.m. Can we have a roll call, please?
Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Brown. Here. Mr. Miller,
Present.
Ms. Stevens,
Present.
we have a quorum.
All right, Madam Clerk, has anyone signed in for public comment today?
No, Madam Chair, no one submitted any public comment.
And can we have a motion to approve the minutes from the last meeting?
Move, Brown.
Second,
second?
Stevens.
All right, moved by Brown, seconded by Stevens. All in favor, say aye.
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 Thank you. Minutes have been approved. Matters referred to the committee today, there were no contractual legislation, but we do have a presentation regarding the Pay for Success program and updates. I know we have two members that may not be familiar with the Pay for Success pilot program that we started years ago. So today, doing that presentation will be Administrator David Merriman. Welcome, David.
Good afternoon, and thank you for inviting me to present today. Before I get into the presentation, I do want to acknowledge that I am working from home today. I think that's obvious from my background, but I want to just share that I'm home because one of my kids had the vaccine last night and isn't feeling so good today. I share that to say that for anyone watching, the Wolstein Center is still open. We walked in yesterday. We had literally no wait at any point. We were in the chair to get the vaccine as quickly as we could finish our paperwork. I want to just acknowledge the amazing work of staff and the Ohio National Guardsmen that staffed that event, and to thank them. They now vaccinated myself, my daughter, and my son. And although my office is not this colorful or nice. For today's presentation, I'll be making it here from a guest bedroom in my home. I am joined today by a colleague, Karen Anderson, who I do think there's a certain amount of credit given to me for my work on this Pay for Success project. But ultimately, it was Karen Anderson that was working on this project every single day through every transition of staff. And I'm really grateful that she's here, and I think she deserves a lot of credit and acknowledgement for really an outstanding job in seeing this program through. Madam Chair, as you acknowledge, there are a number of staff members that have not been briefed on Pay for Success. So I have a very short PowerPoint presentation. My hope is to be able to spend as much time as possible in discussion about what we did and what we're proposing for next steps. If it's all right with you, I'd like to share that presentation at this time. I'll move through it somewhat quickly, but I will be we'll have a longer time at the end for discussion, if that's acceptable.
Yes, thank you.
All right, so I'm going to go ahead and I'm going to share my screen at this time. And I think, Ashley, please let me know if it comes through. Did it go through?
Yeah, it's
Okay.
up there, Dave.
Okay, great. Once again, because this has been a long journey, I'm really grateful for us to be here today to be talking about this exciting initiative. Many of you have been along with us throughout this entire process. I know Councilwoman Conwell has been with us from the start. Council President Jones, Councilman Miller were both co-sponsor of this legislation. We are nearly a decade into the utilization of this strategy. It has now spanned 3 administrations at the federal level and 2 administrations at the local and 2 at the state. And I think our first presentation on this occurred back in October of 2011 when I was invited to the White House to participate in an executive briefing. Brought back from that the really exciting strategies that were being discussed by the Obama administration, and we committed to explore this in a transparent and collaborative fashion. So I think we've made quite a few presentations to County Council and to the public on our, and I think the last presentation we had.
Excuse me, David. Marty, if you can please mute. Thank you.
So
Continue.
last presentation was to this committee back in 2017. And what I'd like to do is just very briefly go over the project, and I'm going to save time at the end for Karen to also provide some comment on how the project went. So just in the broadest strokes possible, Pay for Success is a transition to paying more for outcomes than services from our contracts. Yeah, I think you're all very well aware of the traditional model for contracting. In our environment, this would be the office of the fiscal office provides us resources, generally human service levy dollars, sometimes by the state with federal funds. Those go to the department that releases an RFP for procurement. An RFP for services. We generally spell out how we want the money to be spent and what services are to be provided. And we hope to gather information to ensure that the services have been provided in the ways that the funds allow, which is the compliance component. It's the most critical component in the traditional approach. Hopefully also targeting some outcomes and some understanding that we can improve our services. That's the traditional model. What Pay for Success does is it creates more of a loop so that, yes, we still need to get resources, and yes, we still do provide funding to service providers who provide us data to show whether or not we're achieving the result. But at each step, there's much more interaction. I think at the start, we begin with the funding should be targeted to measurable, meaningful outcomes. And we hope that it's less driven by the funding should be a little more flexible, less driven by federal compliance and maybe stale federal policy. I think our services are much more human-centered. We want to find services that really meet the public's needs, not the funding source needs. And then our belief is that the data it comes to us not at the end, but really throughout the process so that we continue to make changes. And the data is going to be informing us on, are we achieving success? Are we achieving our outcomes? At the end of the day, the data even determines whether or not we've had a successful project and we make a payment on the services. So in summary, this Pay for Success was designed to create this new service delivery model where there is a clearly defined population that is really experiencing a social problem that is completely unacceptable and needs some innovative solution to respond to. That solution should be designed to achieve the outcomes that we believe are important, not necessarily the outputs or the compliance measures that currently exist. There has to be rigorous evaluation by an outside entity that shows whether or not we've achieved success. And if that success is present, then generally speaking, the government will pay for the outcome instead of paying for the service. And that success is determined by an outside entity. So I'm going to pivot now, talk a little bit about our project and how it went and what we learned. So our partners in our project really included a who's who at the local level. I want to especially acknowledge Marcia Egbert of the Gun Foundation. She helped bring this project to Cuyahoga County with her colleague Bob Jaquay. but Cleveland Foundation has been with us from the start. Sisters of Charity has had an enormous investment in this. And then the Reinvestment Fund and Nonprofit Finance Fund have been major national investors, with the Reinvestment Fund putting in the most money. Our service providers included Frontline Services, Enterprise, and Famicos and Eden, as well as CMHA. Jeff Patterson was wonderful to work with. He absolutely tailored housing resources to our clients' needs, and we were really grateful for CMHA's partnership. Our evaluator was Case Western Reserve University. We worked with both David Crampton, who is the part of our Child Welfare Advisory Panel, as well as Claudia Colton and the Center for Urban Poverty and Community Development. The project that we launched, we call it Partnering for Families Success. Its goal was to reunite families. It was intended to serve homeless families that had lost custody of their children. And our hope was that over a 5-year period, or I should say a 4-year period, we would see a decrease in the number of children, the number of days that children spent in foster care. And our hope was to be able to achieve a 25% reduction in foster care days. And to do that, what we did is we sought upfront funding from those funding partners that I referenced before. These entities provide us the funding to do the service. We did the service for 4 years. And at each point, the county was setting aside $1 million in human service levy funds that would be there at the end of the project to pay back those investors if we achieved success. So let me now tell you how it went. The project closed, and the program did not meet one of the specific metrics, which was to reduce the length of reduce the days that children spent in out-of-home placement. So we did not make any success payments. I do want to just take a second and tell you more about what we did. As I said, this was the first Pay for Success project in the United States of America led by a county. We were very, very humbled and honored when the White House reached out to us before launching our program and said, please do no publicity. This is a milestone, and we would like to announce this in a major conference. And that's exactly what they did. This was also the first Pay for Success project in the United States of America to target child welfare and homelessness. So we were trendsetters on this. We delivered intensive treatment to 135 families. It's actually over a 5-year period. We started with an initial year. We started with 4 years. We did add on an additional year of services. And unfortunately, what we found is that reunification for the families that received the intervention did not go quicker than the families that received the services in general. I want to say something more about that. Reunification is always the goal of child welfare. Our number one priority is to try to find how to get those children back to their birth parents. And we believe in that strongly. But what we know is that for us to reunify, there has to be a safe and permanent environment for the child. And what we found, what we believed is that this intervention would allow us to help families to establish that safe and permanent environment more quickly. It turns out that as we were providing families additional support, they actually needed more support. We were building strong relationships. They were asking for more, and we ended up giving them more time. So we did not serve the families in the intervention. We did not help the families in the intervention get their kids back quicker. But what we did is we actually had an enormous impact on the reunification of the African-American families that had lost custody of their children. This is something I'm just extremely proud of. So 69% of the African-American children that were in this program were reunified with their families, versus 55% of the children that were just getting the standard of care for that normally is provided to all children in our community. And that's to me one of the most important and most real impacts that we've had in the past 10 years that targets a known inequity within our health and human service system. Please know, this is my opinion, but I consider it fact. I feel child welfare is the hardest job in local government, save for maybe law enforcement. Law enforcement individuals put their lives on the line every day. So do child welfare. Child welfare workers go into some of the most difficult environments to make critical life and death decisions every single day, every single hour. And the families they serve often face unimaginable challenges, such as housing, such as domestic violence, experience with trauma, substance abuse, mental illness, poverty. The families we serve are amongst the neediest families in our country. And so our staff have difficult work and difficult decisions to make about how to reunify and when to reunify. But what this program was able to achieve, what the Partnering for Family Success program was able to achieve, is something that deserves attention. And all of the providers that were part of this, as well as the staff of DCFS, should be proud that we were able to reunify more African-American children than the standard intervention achieves. And this is a local problem, but really is a national problem. And as I point out here, across the country, African-American children represent 30% of the population, and yet there's 64% of the children in custody. I mean, that's a clear racial disparity. And nationally, 23% of the children in foster care, so they're 60% of the 30% of the children, 64% of the children in foster care. So this is a well-established local and national problem. I think I conflated them. The first was for the county. The second is for the country. So our belief is what we really owe it to the families, we owe it to the community to determine, is this a success that can be recreated and can be achieved moving forward? Can we do this intervention to help African-American families achieve reunification at a higher rate? And so here's the proposal. This is what we're asking for. When I'm done, I'm going to ask Karen Anderson if she'd like to say anything about the project per se, and I'm going to stop. I'll stop sharing my screen after this slide. We're asking to have $1.2 million transferred from the Social Impact Finance Fund to the Division of Children and Family Services. We would like to maintain the balance of the Social Impact Finance Fund where it is, and I'll tell you more about that in a second. We'd want that money to go to DCFS. And we want DCFS to work with our Division of Contracting and Administration and Performance to do a request for proposals, because we'd like to see if we can replicate that outcome of increased unification for African-American families. We want to do a 2-year program with an option for one additional one-year continuation of services. We'd also like to fund the evaluation. So before I turn it over to Karen, I'm gonna stop sharing here. And part of what I want to do is I do want to just take a second and just tell you a little bit more about that other option of trying to get maintain the SIF balance, maintain the funds in the Social Impact Finance Fund. As I said, there is $5 million sitting in the Social Impact Finance Fund right now. And that money can only be used for a pay for success project. And so it's there for these purposes. And I want to share with you, because of our participation in pay for success, the treasurer of the state of Ohio, Robert Sprague, asked me to be on the advisory board for his an initiative that he began in the state of Ohio called Results Ohio. And Results Ohio is trying to leverage this pay for success strategy to see more contracting to outcomes services provided in Ohio, have government pay for outcomes more than government paying for services. And the treasurer has actually had a proposal process, and they received an application proposing a pay for success feasibility and potentially a project that would target participants from the Ohio National Guard and recipients of the Ohio National Guard Scholarship. And what the hope was is that they would develop a project that would create customized higher education coaching services for scholarships. And the goal would be to improve post-secondary completion rates and eliminate outcomes of disparities among scholarship recipients. The partners in this proposal would be the Ohio Department of Higher Education, Results Ohio, the Ohio Adjutant General's Office or Department, and then we hope Cuyahoga County. So I'm sharing this to say that this proposal is live. There is a project available right now that we are exploring, and we're talking to Results Ohio. I've had multiple conversations with Treasurer Sprague personally, and I support this as an initiative to help us really enable policymakers and innovators to pursue projects that fund outcomes as opposed to funding services. I have talked about this initiative with College Now and others, and I think what we all recognize, and this is where I'll close, and I'll ask Karen to share some information. We all recognize the value of the Ohio National Guard. And as I sit here, what I'm thinking about is less than 24 hours ago, an Ohio National Guardsman gave my son, a vaccine for COVID, right? An Ohio National Guardsman gave my daughter a vaccine for COVID. They gave me a vaccine for COVID. This entire year, I've watched the Ohio National Guard staff food distribution at Burke Lakefront in the Muni lot in all weather. We've had the Ohio National Guard staff the county jail when we had staffing issues and secure our communities when peaceful protest turned into criminal activity. And so I'm left recognizing there is a deal on the table with the Ohio National Guard, the Ohio Department of Higher Education, that could involve federal funding, and the county could play a role in seeing that program launch in our community, potentially as a pilot. And so there's a lot of details to still be worked out here, but I would propose as a county, we have a commitment to doing scholarships. It's written into our charter, but scholarships are not enough. In the same way that Say Yes for Education provides a scholarship, it also provides a supportive service. And that is what our guardsmen need. And I think it's our obligation to figure out if we can be a part of responding to that need. I think we owe it to them. I do think they have now been exposed to the medical field as they've provided vaccines, as they've been exposed to careers in criminal justice, as they have staffed both the jail and the community. And they've been exposed to supply chain as they've helped give out food in our community. So I think it would be a win-win for us to explore, can we work with Treasurer Sprague's office in Results Ohio, the Ohio Department of Higher Education, and the Adjutant General's office to see if we could pilot this strategy at a local level. So that's an example of how I think we can be moving this project forward. My stated request will be to move the money, 1.2 million, from the Social Impact Finance Fund into the county, the DHHS budget, so that we can develop an RFP and have open competition for the project. And I would like to begin to explore whether or not we could work with our partners at the state to see if we can do something for National Guardsmen. Before I finish, I do want to just pause for 1 second. I want to ask my colleague, Karen Anderson, who, again, she's lived with this project for 5 years. She's done an amazing job. Karen, I'm sure I've missed an opportunity to acknowledge you and the staff of Frontline Services, Case Western Reserve, Enterprise, CMHA, anything that you would add to my description of how the project went and your thoughts about where we're going.
Thank you so much for your kind words, Madam Chairwoman and council members. I think one of the questions that I'm asked most frequently about our Partnering for Family Success / Pay for Success initiative is why? Why did we end up reunifying African-American families at a much higher rate than we do sort of with services as normal? And, I can't answer that 100%, but I do think having, look, when child welfare takes your child away for the best of reasons, right, with the permission of the court, because kids aren't safe, it is disheartening and it is painful and it is maddening. And I think when you're already sort of disproportionately used to have to bucking up against systems, perhaps because of systemic racism, the idea of having a partner like these families did with Frontline, who was in there for everything. In much of the comments in the qualitative evaluation, our families would say stuff like, I just felt like I had somebody in my corner. I just felt like when my social worker kept explaining to me, I have to do this, I have to do that, I felt like Frontline would just tell them she's already doing it, right? So what I'm saying is, again, I'm part of the child welfare system, and I'm not trying to badmouth us or bash us. In some ways, we have in this project, what came to light is, the child welfare agency, our focus is always child safety. And Frontline certainly was concerned about that and aware of that, but they were the advocate for the parent. And I just think given our resources, we don't always have that same intensity. I don't know if that made a difference or not, but what I can tell you is our families felt extremely supported by having someone navigate. The other piece that I'll say is, child welfare staff are not experts at helping people find jobs or helping people find housing or navigating education, right? We're good at, getting kids into counseling and helping understand foster care and all of those things. And having that additional navigator to help families with the kinds of services they would need to stabilize themselves if their child returned home was critical. So, that's those are sort of my thoughts about that. Again, no, we didn't do it faster, but much of our reunification rates have stuck, right? One of the things that child welfare has shown is, in Franklin County, their lengths of stay for foster care are shorter. Their return rates for kids are higher, right? So if you have to spend a month or two longer in foster care, isn't it better that everything is sort of straightened out before the child returns home? And that's one of the things that we found in this project. So with that, thank you.
So I would recognize in closing, I neglected to acknowledge my colleagues at Third Chapter Capital Partners. They did provide me with some of the information today. They were part of standing up this deal as well. And part of the reason I acknowledge them is they continue to talk at the federal and national level, trying to find resources to get to communities that are exploring this strategy. And they've been a partner in this as well. So, Madam Chair, I'm going to stop there. I probably spoke longer than I would have liked, but I know there are a lot of questions, and Karen and I are going to stay on to answer any questions you have.
Thank you, Administrator Merriman. How many families were served over the years?
Our goal was 135. Karen, do you have an actual in terms of how many received the intervention?
I believe it was 138, but we stuck close to the proposed number, 138.
And when we started, Madam Chair, and some of this was pointed out by you, and I'm giving you acknowledgement that early on we said mothers, and very quickly we recognized that was limiting, and we actually had to change our contract to say families and parents, because we did serve fathers, and these were one parent, two parent, and single parent families with men and women as the parents, and that was something you caught early on, and we actually adjusted the contract to accommodate.
There were also 281 children out of those 135 families
That were reunified, correct?
that were served.
That was served. Okay. Do we know the reunification number?
I will pull it up.
And
Sure.
hopefully they're still with their families, right?
So, I can't say that we followed when the project ended, the evaluation ended, some of the families are still being served by us. We haven't gone back to do a retrospective assessment to see what happened after the project.
And what was the project end date, Merriman?
Well, we ended up finishing in the later half of 2019. And we did get a little bit of extra funding, and we provided a longer close down period for families that were engaged late into the initial 4-year period. I want to say it was September of 2019. Is that right, Karen? You're muted, Karen. All right, we'll keep going. I think Karen's having a technical issue. We'll get-
Sorry about that. Yeah, it was October, I believe, was the last family served.
Okay.
Okay, David, was there any interest earned on the initial $5 million?
A small amount. We did put it in an interest-bearing account, and that money went into the project. It was a very small amount. We didn't get the full, well, the 5 million was our money, and it sat in the Social Impact Finance Fund. The 4.2 million raised was private investment, and that sat in an interest accruing account. Well, we didn't get all of the money in day one. We got it over a series, over a period of time. So there was not a lot of interest raised. There was just it was a small amount.
And as we move forward, what role will the previous funders play in the new direction of this program?
At this time, I don't know that there will be. Some part of what we said as we wound this project down, we really hoped to achieve the initial designed outcomes of increasing reunification. I think it was our intent to pay back our investors. But when we launched this project, we said we're going to test this intervention, but also the discipline of the county to see this through. And if the success is not there, the county will not pay back their investors. It wasn't, that success metrics was not there. We did not pay them back. They were aware of it. And so, this ends up being additional resources we got. And when we spoke to them about it, and they did ask the questions, what will we do with the 5 million that was raised? I shared with them that I intended last year to propose if we could reprocure this and try to recreate the outcomes that achieved some increase in reunification. So they understood that our goal was to try to recreate this service. I think last year in the pandemic would have been a bad time to start something like this. So we've just delayed the proposal until now.
Okay, so I just want to be clear. So private funding, we raised 4.2. During every year, we were putting away an additional million. So is it safe to say that we had a 9.2? No?
Look, we raised 4.2 and we used 4.2. We set aside 5 million that would have paid back the 4.2 plus a small return on investment. And so if we'd gotten a 25% reduction, every one of the providers would have gotten back what they invested in us and a range of a return of investment of a few points to maybe six percentage points on their investment. We also had a little bit of money in the 5 million that we had set there as if we exceeded the 25%, we were going to over incentivize. We were hoping to get kids back as quick as possible. That turned out to be a moot point. So our 5 million is still sitting in our account. There is no obligation that we pay anyone back.
Okay, so our balance is 5 million.
That's right.
And you want to move 1.2 million, and I don't think if the previous private funders are not playing a role in how we move forward, what is the 1.2 for?
It'll be more like the traditional standard county approach to services. 1.2 million will be moved into the DCFS budget. And what we'll do is we're going to draft an RFP, release an RFP, whose goal will be to achieve the same outcomes: increased reunification for African-American families. Frontline Frontline or anyone else will be allowed to come forward with proposals, and we'll make a decision about which intervention has the the clearest chance of achieving those outcomes. So this is something like what we would normally do with levy dollars. These are levy dollars. They're sitting there, and we just want to put them to good use, trying to recreate the success of the project.
So to some degree, it's like a continuation of the initial pilot. It'll just be up under our umbrella.
It is, but Councilwoman, I do want to just say we procured the initial project back in 2012. And as I sit here, I'm not going to commit that we're going to fund the same providers in the same way. It will be an open RFP. And if someone can come along and say they could do that or something better, then we're going to look at it. But, I also understand that I imagine Frontline will consider applying. I'm not going to say that we're going to continue to fund this provider or that provider.
Do you have the RFP? Is it written yet?
It is not. I wanted to ensure that I had supportive counsel before I move forward. I think the RFP would be worked on this year. The goal would be to release it this year and for services to start next year.
Well, I think I would like, I don't know the mechanism of what goes into an RFP, and I'm not even gonna pretend I do. But is there a way that Levine or one of our staff can be in that process to, I'm a little leery to just say, yeah, move forward, and we don't know a whole lot of detail of which way you guys are planning on moving. Would that be okay?
Yeah, I'll gladly sit with Levine as we get closer to having the RFP drafted with the support of this council. Yeah, I'll get some input. We'll share our plan prior to it going live. And then obviously, once the RFP goes live, it's a public document. And then clearly, whatever we do coming out of it will go back to county council. And we'll most likely need to get county council or board of control approval before it can be acted upon.
Yeah, I with the 1.2, you might have contracts that would go to the board of control, but since it's been a pilot program with dollar amounts that were for the council as a whole, I wouldn't want, I'm requesting that they don't go to board of control.
I understand.
That's just so we can keep a full, if some of those contracts come after under 500,000, I'd rather it just stay in the committee so we can all stay abreast of what's going on. I know others have questions, but I wanted to know another question in terms of the million that we put in every year. Will we continue to put in this million every year?
No,
So
No.
that's done.
that's done.
So we have 5 million sitting.
Yep.
Okay.
Now, I obviously have proposed that I'd like to keep working on these sorts of initiatives. I mean, I should share with you, under the prior presidential administration, they released $100 million in pay for success, or they budgeted $100 million for pay for success projects. And and then Treasurer Sprague's project is also something that's looking to leverage this opportunity. So I hope that we continue to play in this space. Some estimates are there are $40 billion of impact investment available in the United States of America. We do have a national reputation on this. So I really do hope that we can keep working on pay for success and these social impact bonds. But pretty clearly at this time, I'm only asking to consider the 1.2 million. And then I also did want the council to know that I've engaged with the Ohio Department of Higher Education and the Treasurer of State and Third Sector and others to see if in fact we could get involved in that National Guard project. So we want to be active in this space. We have $1.2 million worth of use right now. The 3.8, I think, it's an amazing resource. It could allow us to step into an existing project quickly with the executive and council support.
May I just interject to answer your question? There were, again, 271 young people in the project. 148 of them returned home to the parent we removed from, but 221 of them exited foster care at some point during the project. So what I mean is some were adopted, some went legal custody to a relative, some we may have returned to the parent who was the non-removal parent, right? Mom and dad weren't together and, kids had never lived with dad, but we returned. So 221 out of the 270 were left foster care, but out of that one, or out of the total, 148 went back to their parent.
Okay, thank you, Karen. I'd like to hear the thoughts of Councilman Miller. I know he was very instrumental in with this pilot program back in the day, and he probably worked with Karen, and I know he worked with David Merriman. So Councilman Miller, do you have any questions?
First, by way of comment, I would say that this was the first Pay for Success project done at the county level anywhere in the United States. So it was indeed groundbreaking, and I would say that the ultimate purpose is to serve families and children better. And so, although we didn't achieve the numerical goals in terms of achieving cost savings, we achieve favorable outcomes, particularly on diversity related measures. So this was a significant accomplishment. So I think it's certainly worthy of continuing to follow up on this program to try to confirm that the results that we achieved in the original project are achievable going forward on a consistent basis. And the one question that I would like to ask is whether the National Guard program is a Pay for Success project. And if yes, if you could briefly explain the Pay for Success model that would be involved in this project.
Happily. I first just want to acknowledge Councilman Conwell. Councilman Miller was a co-sponsor at the onset of this, as long with Council President Jones. The Council Miller was with us from day one, and I am absolutely certain we could not have moved forward without his full support. I'm certain of that, and I know that his investment in this contributed to us launching. That is not hyperbole. It is absolutely clear to me. So thank you very much, Councilman Miller, for sticking with us and for your support. So let me share a little bit more information about the Adjutant General's of the Ohio National Guard's scholarship proposal. And please know this is available on the Results Ohio website. There are 6 proposals that have been submitted to the Treasurer of State for Pay for Success feasibility. They range from reentry programs to workforce programs that target dislocated workers in Cincinnati and Columbus and in other communities. And the proposal that I'm bringing forward today was presented by the Ohio Department of Higher Education, working with the Adjutant General's office and working with third sector capital partners. And what they acknowledge, there are something like 600 guardsmen every year that go to a college with their scholarship. You know, I think of it like the GI Bill, but too few drop out. I mean, too many drop out. And we don't always know why they drop out. And you have this amazing opportunity that these guardsmen who have served our country and served our community and have access to scholarships and are clearly hardworking men and women are not completing college. And we don't know why. And I don't think there is a why. I think there are whys. I think there are a lot of reasons why people that start college don't finish college. And so the proposal that has been submitted to the Treasurer of State and is on their Results Ohio website speaks to an initiative where national funding is available that would fund the intervention, the coaching, and the individualized support that would be offered to these guardsmen. That national funding would be tailored to the guards, would create a service that would be tailored to the guardsmen's needs. And if that service achieves outcomes of helping these guardsmen advance through their college career and complete college, then county funding would be available to pay back that national funder. So this is much like our first Pay for Success project. Our money would be available to pay back a national investor if we achieved the outcome that we discussed. And the outcome is guardsmen complete college. Now, a lesson that I learned from the first one is you don't do this all on one outcome. I think we should look at multiple outcomes. And so maybe there's payment points along the way. You get a guardsman from nothing to an AA degree, an associate's degree, or a certificate. I'd also like to say, I think all of our programs should be looking at incentivizing significant advancement of addressing racial disparities. So I'd also like to see, not only do we help guardsmen complete their college degrees, I'd also like to incentivize having a higher percentage of African Americans and minorities complete their degrees. So those would be my goals. Again, there is national funding available for this. Our role would be to pay back that funder if the outcomes are achieved.
Okay, thank you very much.
Thank you, Mr. Miller. Mr. Merriman, what role will Karen Anderson play in moving forward?
It's a good question. I'd have to talk to Director Weiskettel because she does report to Cindy. Karen has established a national reputation, and she's regularly serving on panels on pay for success. She's talked to organizations around the country and internationally. So I hope that she'll be involved. I'd like to ask her to help with council support on the RFP and standing up to service. But I also have to say, when Karen and I have talked about this, we recognize, a project like Pay for Success is also an amazing leadership development opportunity. And if Karen and I get involved in these, and my office is 3 doors down from Karen, I think Karen could get anything done that she wanted to get done. But if we don't start to draw in staff from broader parts of the organization and give them the opportunity to participate, then we're also not letting them develop as leaders. So I hope Karen will continue on. It's something I'd have to discuss with Cindy and Karen. But I also hope that we can get more people involved in this so others can learn how working in a public-private partnership that's focused on impact and achieving a social impact is a good way for government to work.
I'd like to open it up to my colleagues for any questions.
Madam
Councilman
Chair,
Scott.
not necessarily a question, but I think this is incredibly important. I think that the one way most Americans can improve the quality of life is by getting a decent education that provides them with the right skill sets to figure out how to improve their own quality of life and invest more in it. So this is something that I am happy to be a supporter of. I'm glad you brought this to our attention.
Thank you.
David, was Mr. Merriman was.
Thank you, Director.
Thank you.
All right.
Hey, Madam.
Councilman Sweeney.
Thank you, Madam Chairwoman. First and foremost, thank you for bringing it to mine and Councilwoman Stevens' attention so we can get a fuller handle on it. So thank you. And to Director Merriman. Rosen? Okay.
We still got you.
Yeah, he's been going in and out today. Now, David, you did, while we're waiting on Councilman Sweeney to come back on, you did mention, and I had kind of wrote that down. Is there any other HHS agencies that could develop some sort of pay for success programs, since there's so much possible money that's available on the federal level?
That was terrible. I don't like using my phone when people call in. So if you heard anything.
Hold that. Go right ahead, Councilman Sweeney.
Using my phone is not the best way. I have to get away from this. But thank you. And to Director Merriman, good job. But I really want to thank you for allowing me to come over. As you know, been on the job 3 months, trying to dive into this stuff. This just gives me another opportunity to go a little deeper and understand the great work, as he said, of the employees there. The case workers, I consider them frontline employees. Through this whole PPE stuff, they weren't mentioned once, but they're equal because they do it every day and they've been doing it for years. My first job as a intern when I was in high school was at East 30th, where the Board of Election was. It's where the caseworkers had their offices, and I was an assistant caseworker helper. So I got to see firsthand walking into houses that I wasn't familiar with and dealing with the stress and seeing the caseworkers' everyday realities. So this is just in my eyes, something that was invested in that shows results, but they're more long-term results that put a family together, and it's not built to only last a little while. And you may not have more success, but the success lasts longer. That's the thing I learned most about this during this, and I'd be fully supportive of this. I just want to tell the director, keep up the good work. I know you're getting, beat up here and there, and your workforce is a wonderful workforce, and I'm proud to call them coworkers. So, Madam Chairwoman, keep bringing the stuff on them. Sometimes I'm a slow learner. I might have to go to remedial class. I might have to go over, visit them for a little bit more in depth, but I'll keep trying to figure it out with you. Thank you.
Madam Chair, if I could respond, and then I'll answer your questions about the other departments.
Go ahead.
So first, I want to thank Councilman Sweeney, and I know that Councilman Conwell, you've been to our office many times. I know many of the council members have. I think we all agree that being a child welfare worker is one of the hardest jobs in America. It is not an exaggeration. I've done the work. Many years ago, I was a child welfare worker, and I don't think there are many times that a person has to make heavier, more complicated decisions in an urgent and critical fashion. So thank you for your support. I think that is in some part of the reason that we are excited about this project, because much of what it does is it allows the worker to do their job and to stay focused on that child's safety, because that's what they're going to do no matter what. And a lot of times workers don't have the bandwidth to go learn about how complicated it is to get a person, you'll excuse me, through a public housing process, because they have their own significant reasons, but also bureaucracy for lengthy process, or possibly the shelter process, which is it's very well intended, and there are federal funds that have to be used the right way. So what is exciting about this is this allows a social service worker 3, the Division of Children and Family Services, to do their job. And it supports them to do their job by helping the family get a resource in their home that's committed to their needs. I do just want to recognize that these frontline workers that were in the homes of the clients served by this intervention, they are mandated reporters. So I don't want to leave it with the perception that they're also focused on child safety. There were times that they were calling in referrals as well, and they were part of the safety planning process. And not every family was able to be reunified, because some unfortunately had continued risk, and Frontline stood shoulder to shoulder with us in those difficult times as well. So their service is a service to us as well as the family. But I do think anything we can do to support social service worker 3s to do their job better is something we should all be committed to. So Councilwoman Conwell, you brought up the point about what other departments are available to look at pay for success programming. We did a feasibility study looking at whether the universal pre-kindergarten program could be funded through pay for success. Unfortunately, it did not seem like there was a way to have that program move forward, because a lot of the outcomes of UPK, which are exceptional, they're, bar none, they're some of the best outcomes that exist in child welfare. When you fund high quality universal pre-kindergarten the way that we do, the problem is those outcomes accrue over time, and you need a longer runway than naturally exists on these contracts. Similarly, there was a feasibility study looking at whether lead paint remediation or lead poisoning remediation could be targeted through pay for success. Another great idea, and there's some awesome work being led by Enterprise Community Partners and the Cleveland Lead Fund Coalition. And unfortunately, that's another area where the great work that exists there, it needs to move forward. It doesn't fit with pay for success, because there's a lot of ways in which children get exposed to lead poisoning, and to tie it just to the house or tie it to one other area where you might be making a payback is a little bit complicated. I will say the final area, and this speaks to Councilwoman Stevens' feedback about getting education. I agree with her 100%. So much of what child welfare does is responding to neglect, which frequently is contributed to by poverty. And in fact, neglect and poverty look a lot alike. And the best way to address poverty is a job, and the best jobs are funded through supported through an education or training program. It doesn't have to be college. but some form of education and or training. And I would tell you that this is an area where we really want to explore more of these pay for success projects. The prior federal administration launched a program, the acronym was CIPRA. It had a procurement. We didn't go after it. Long story short, the Biden administration just announced a $9 million pay for success project targeting green energy jobs in New York, in the state of New York, through pay for success funding. I think that's important. I think we should all be looking at how we fund these workforce services, education, and training so that we can help our residents get into the jobs that really they need, our community needs, and our employers need. Because I can tell you, Workforce Connect, our sector partnership initiative, they're very active, and they're asking us, please send us more trained candidates, send us more people that want to move through these programs. I do believe this is a win-win-win. If we can bring in funding for good programs and services that are proven to be effective, and we can get that funding to the residents that need it, we can help the residents, we can help their community, and we can help our area employers.
In terms of the, I think final question for me, in terms of reunifications, what we've done previously with the Pay for Success program, where will that now be?
So, those cases generally have closed. I'll ask Karen if she wants to add anything else on it. I mean, as far as the program, the program has stopped. Residents that go to DCFS still get a very high quality service. They can still get just some exceptional resources. And Cuyahoga County puts much more money into the child welfare system than we need to, than that it is a requirement of state funds and programs. So we do a lot with these families already. We just don't have this intervention anymore. The families that received the intervention, as Karen said, most of those children were reunified and their cases have ended. I can't say whether or not any of them have come back at this time. I do know the services that remain, our standard of care is still much higher than most of the state of Ohio. We just think, we could do more.
Yeah, I understand that that most of them have went home, but I'm just wondering what's the thought process of even though the program was successful, barring one part of the program, why would the thought process be that we wouldn't continue for the new kids that are in the system?
We'll need to get the resources. We want to continue. We want to continue this project. That's the goal. I would say part of our goal is to still look at doing a randomized controlled trial. I should say a little bit more about that. There is new federal funding sources that are becoming available that will fund prevention or will fund enhanced services like this if you can prove that they're an evidence-based intervention. So I do think what we want to do is we want to get the money, we want to do a procurement and get a service provider, and we want to begin to continue to offer these services to the children and the families coming into custody. I still would like to see if we could do it as a randomized controlled trial so we can demonstrate to the federal government that they should be funding this. This shouldn't just be about a county priority. The Fed and the state government should see funding serving families in the way that Karen Anderson described it. That's how we should be doing services anyway. We should be having individualized, customized, in-home wraparound services that look at the parents' needs so that child welfare can really focus on the safety and security.
All right, one final go around. David, is there anything else you'd like to add? And my colleagues, are there any further additional questions or statements or?
So the only thing that I would say, I introduced the idea of working with Results Ohio. And, I do just want to acknowledge, I have not brought a final proposal to County Executive Budish or to County Council. This is in the exploration phase. We see a deal out there. We've told the state we would like to know more. If the problem that they're trying to look at with this Ohio National Guard's strategy or intervention, if it exists in Cuyahoga County, please tell us, because we want to support those residents that are guardsmen to finish college, and we want to find a way to do that. But I don't have a proposal in front of you on it. If I do, if I get one, I'll bring it back and we'll be talking about it.
Okay. And any final questions from my colleagues?
Nope, thank you.
All right. Thank you. And thank you, David, and thank you, Ms. Anderson, for a thorough presentation. Kind of brought me back to some things I didn't quite remember.
Well, I thank you, because I think you invited us to come forward and bring more of these contracts early on in these services early on, Councilwoman Conwell. And we're really pleased to be able to have something and to have council look at something for 10 years and to be a partner has really been great for us.
Thank
Okay.
you.
All right. Any miscellaneous business? I would just like to share that I apologize to Clerk Johnson and Clerk Janine in regards to the agenda. I forgot Ashley was off, so I'm looking under Ashley's name for for everything, and it was Janine that's in it. So my bad, my mistake. I did have it, but thank you very much, both of you. And without any